In most of the less developed countries, healthcare systems are informal, insufficient, or non-existent. They have major shortcomings as hospitals with intensive care units, enough doctors and nurses, and overall a functioning state with appropriate resources and capacities. Considering that even developed countries have been struggling to respond to this pandemic, you could imagine the scale of the problem we are facing here with LDCs. And this challenge becomes even more magnified in the context of conflict zones, because then you've got to think about issues like security, access to war-affected populations, destroyed infrastructure, and divided communities. At least in the early stages of the pandemic, there was hardly any attention on the challenges faced in LDCs and conflict zones. However, this has now started to change and have a stronger momentum with a number of key initiatives by the World Bank, United Nations, international NGOs, and some private companies and foundations. These are mainly additional funds to support the health systems of these countries. However, much more is needed. And the need is not only financial. Overall, they need our international cooperation in all aspects of the pandemic response. Well, first of all, if nothing else, there is a moral responsibility for the humanity to help each other in solidarity. And second, the pandemic could also worsen the security situation in some of those conflict-affected countries, or without appropriate assistance, the economies of LDCs could collapse completely. Subsequently, this would create new and much greater security, humanitarian, and development problems for the future. And finally, helping LDCs would speed up the control of this pandemic for a quicker normalization globally.